Hi, I'm Dr. Robert Burke. I'm the founding partner of this practice. In 1982, I moved here with my family from Canada, answering an ad from Westfield Hospital because the doctor in Mayville had passed away and they were looking at finding a doctor to run a family practice in Mayville. October 9th, 1982, I opened a small office in a rented house on Elm Street, 55 Elm Street in Mayville, with a nurse and a secretary and myself, working half days because I also was working as the public health director for the county because that doctor had also died not too long before I got here. So for 5 years, I worked by myself, though after the first year I moved and actually bought the previous doctor's house at 99 South Erie Street, renovated it slightly and ran a practice by myself for 5 years, and then took on a partner for about 10 years. After which we built a large new facility on South Erie Street, East Chautauqua Street, and grew the practice with a couple of extenders, and then until we had 4 extenders and 2 doctors. In 1999, I took on another partner. We began looking into Jamestown and opened an office in Jamestown, a small office with a nurse practitioner. And in 2000, we went electronic. A great leap. We were one of the first practices in the county to put in an electronic medical record, which we continue to do. We're 20 years into it now. And in 2009, we merged our practice with a family practice that was run by the hospital in Jamestown, doubled our size overnight. And since then, we've been just growing and adding providers. We now have close to 17,000 patients, 4 doctors, I think 11 extenders, nurse practitioners, and physician assistants, with 85 staff working out of 3 offices. This office that we're in right at the moment is our newest project in Westfield. We just opened it, state of the art. And we're an interesting practice. We have patients as young as 2 days old and as old as 100 years old. We provide service to the whole community. We accept everybody who comes through the door. A quarter of our practice is Medicaid. A quarter of our practice is Medicare. The rest are a variety of insurers. Coming from Canada, and one of my partners comes from Russia. One of my partners also comes from Canada. We come from healthcare systems that obviously were universal care systems, so we just accept everybody and work out the details afterwards. We are deeply involved in our community. We have 3 school systems that we're the physician for. We have 2 hospitals that we provide hospitalist service for. We have a nursing home that I'm the medical director for. We're also involved in year-round philanthropic work in our community. Each Christmas and Thanksgiving, families in each of our offices receives a Christmas or Thanksgiving meal for families in need. Since we began the practice, we have endowed a local charity that looks after children and families that have to go to Buffalo for specialty care, need money for gas or for lodging. We endowed them for $200,000. We then raised money for hospice for their endowment. I think it was around $100,000. And presently, we're working with either the food bank or local charities with our Polar Plunge project, where we've raised about $44,000 to $45,000. We feel it's very important to give back to our community, to those in our community who are less fortunate. What we're looking for in our employees is a sense of initiative, a sense of obviously honesty and caring, not only for the patients but for the other employees. We are looking for people who fit into our family. People spend more time with us at work than they do probably with their own family during the week. And that's the way we envision our staff interacting. We care for each other, we look after each other. We want people who come to work for us to feel like they're part of a team that works hard, and we expect everybody to work hard, work with initiative, come up with ideas for us. And we expect also that we care for each other. With this number of employees, obviously things happen, some good, some bad, and we share those with each other to make sure that our employees feel that they're being looked after and they're part of a team. For the last year and a quarter, we've been involved in a very large reorganization of our management process. And this began with just the managers and now involves everybody in the practice. We meet on a regular basis in small teams to look at how we can do what we're doing better, how we can serve our patients better, how we can manage the workload, which does not get any less each day. It's just more and more work just because of the inflow of data and information that we get on everybody. So that we have teams, the clerical team, the billing team, the providers, the managers, each working in groups for short periods of time each week just to look at how we can function better. And we value the input of every employee because they're part of a very large team. Our plans for the future are very simple. We're growing. We are looking at expanding significantly over the next 3 to 5 to 10 years. And to do that, we have to be efficient. We have to be able to make sure that our patients and the community understand what we're doing and value the service that we bring to them. If we can do that, then we're successful.